everybody out of here. How's the glare off my head? Is it okay? We're okay? All right. Yeah, I don't want to blind anybody here, but I want to welcome everyone here today. My name is Ryan Smith. I'm the CEO of the hospital, and it's great to be here today. This is a very exciting day for our organization and hopefully for our community. We are very excited to be able to address a lot of the concerns that you've brought to our attention by being able to build this medical office building where we'll be able to house our providers and staff. We'll have better parking, so better access to our providers. We'll be able to do centralized scheduling and registration with our providers, and it'll free up a lot of the parking around the hospital area also. And so and we're really interested in creating this patient-centered medical home and creating a multidisciplinary approach for our providers to deliver care to our community and to their patients. And so it's a very exciting day for us. Your feedback has helped get us here. And,
Good morning. This is a very great time for the hospital, since I'm an employee also of the hospital, and to the citizens of Douglas. We're a growing city, and I'd like to see a new building here for especially our senior citizens. It's easier for them to get into. They don't have to go up the elevators and confused on which way to go. And for the future of Douglas, the board has done a great job with looking at that. With the city growing and the more energy coming in, the more people, this will serve for a long time.
As Ryan alluded to, projects like this don't happen without a group effort. And for those of you who are here that have been Converse County residents for a long time, and think back to where our hospital used to be a few decades ago and where it is today, it's just amazing that the quality of health care that we can deliver in a small county, in a small community. You know, one of the top 100 communities, a top 100 hospital, patient surveys, satisfactions, doing nothing but increasing, and a recognition by the leadership that it is time to take the next step.
This building is way more than a parking solution. It's, to me, it's the end of what I like to call the hero failure mode, where a provider has to be in two places at once and always tell patients to be patient. You know, you can't win doing those sorts of things, and you can ask me. I tried for many years, and many of you can tell me how I failed, I'm sure. This is the beginning for us of a very concentrated devotion to team care that still respects and honors individual relationships. Now, I know it sounds contradictory, but that's where we are and that's where we're going. We're very devoted to this, and you've heard some terms like patient-centered medical home. We're going to be rolling out some things like a community attack on obesity as a population type of an approach to try to fix things on a more powerful scale than waiting till somebody has a heart attack and then has to go through a, high technical, high cost care. Prevention is where healthcare should go. This building will be a big part of that.
You know, when I look back on the history of this hospital, I've seen a lot of changes in the last 16 or 17 years. 16 years ago, we were doing about $500,000 a month in revenue, and now we're doing $4.5 million a month in revenue. One of the reasons we need this medical office building is that 15 or 16 years ago, we had 6 providers. We now have 21 providers. About 12 years ago, we had a similar ceremony to this. We had a groundbreaking for the addition to the hospital down below here. And we thought at that time that that addition would satisfy the needs of the community and the hospital forever. But we've experienced over 400% growth in the intervening years, and we simply need a place to put everybody. And what you've heard before is that we need to find a place for the providers that is better for the patient and better for the community and the providers themselves. And so that's what we're doing here. So the next party we're going to have is going to be in December, and that's the completion of the medical office building and the dedication of that building. I'll invite all of you to attend that, and we'll see just what a wonderful opportunity this is. So thank you very much.
All right, on 3, I say we should all dance. Ready? Let's all count. 1, 2, 3.